Hello, everyone, and welcome to our sixth episode of our COVID in Black discussion series. So, my name is Louis Shackelford. I am an external relations project manager with the COVID-19 Prevention Network. We are extremely honored that you all decided to join us this evening. We have a dynamic panel of speakers that are really ready to talk to you and share their thoughts. This episode is going to be focusing on vaccine mandates in Black communities. And so we want to launch into our discussion as soon as possible. I just want to make a quick note that Dr. Stefan Wallace, the Director of External Relations, will be joining us shortly, and he will be our moderator for most of the evening. And with that said, I will begin with introductions, and we'll just go around the panel and have our panelists introduce themselves. Dr. Carter, you're first up on my little box here.
Well, great. Hello, I'm Dr. Vivian Carter. I am bringing you greetings from historic Tuskegee University, where I serve as the chair of psychology and sociology. My background is in sociology and human relations, organizational development, and transformation.
Thank you, Dr. Carter.
With you.
Thank you so much. Matthew, you want to introduce yourself?
Yeah, sure. Matthew Rose, I'm a director at Global Health Strategies. I've been a HIV, biomedical, COVID, what a consumer advocate for over a decade. I like to talk to people about how do we make science play in your terms so people can make informed decisions about their life and life choices. Glad to be here.
Awesome. Thank you, Matthew. Marissa, you want to introduce yourself next?
I am Marissa Miller. I am the Executive Director of Transsolutions Research and Research Center. We are located in the Midwest, Indianapolis, Indiana. I'm currently in partnership with Johns Hopkins and the LIGHT study to look at COVID and how it has affected the trans population. And I sit as a co-PI on that project.
Awesome. Thank you for joining us. And last but certainly not least, Dr. Furch.
Hi, everyone. Thank you for having me and thank you for joining us. I am Mrna Vaccines. I am one of the physician scientists here at CoVPN and also the HIV Vaccine Trials Network here in Seattle. I've been working in HIV for the last decade and a trained clinician. And when COVID happened, we just got to work. So thank you for joining us. I'm happy to be a part of this awesome panel, and hopefully we can get some questions answered and have a nice conversation.
Awesome. So thank you again to all of our panelists. We are waiting on an additional speaker, George Lee. He is on his way and will be joining us shortly as well. So just to launch in our conversation today, so we are experiencing nationwide just a mass run of vaccine mandates. And this has brought up a lot of contention in people. You know, in the beginning of the COVID-19 pandemic, we heard a lot about people wanting the vaccine and struggling to get it at times. And, you know, it wasn't that long ago, at least in my head, it seems like a while ago, but it's kind of baffling that it wasn't that long ago when people were struggling to get vaccines, and you had vaccine programs specifically for people of color. And then we heard about people outside of communities of color, you know, swooping in and stealing spots or taking spots away from, let's say, taking spots away from people of color who were trying to get the vaccine. And so now we're in this dynamic where we have access to vaccine, and vaccines are so prevalent that they're being mandated, but having mandates is causing an issue within itself. So I just wanted to open up the floor and get your perspective on what these mandates mean, why they're important. And I see that George Lee has joined us. George, do you want to introduce yourself to the audience before we get started?
Yeah, hey, how y'all doing? It's your boy Conscious Lee, George Lee, GeorgeLeeSpeaks.com. You can find me at. I consider myself an educated shit talker. Always gonna have some education provided with it though. I'm able to quantify whatever shit I'm talking with some facts, some research, statistics. You know what I'm saying? I'm happy, privileged to be a part of this conversation with some real life experts though. You know what I'm saying? And it's about to be a real groovy like Austin Power movie.
All right. Thank you so much. So, vaccine mandates. What are our thoughts? Why do why do we have vaccine mandates and why are they important?
So I will say this, that my position, like many things with science and understandings, has evolved on this topic. Because initially I was like, screw your mandates, because not all my people are going to have access, and now you're just taking away public space in place where my folks can show up, and you're adding another layer of where people can either be criminalized or charged. And we saw that with mask mandates in New York and around the country, where our communities were overly policed and overly targeted. However, times have been a changing. The numbers have changed, access has changed. We have a whole lot more data and information. And I think that opens up the conversation of what does it mean to protect yourself and protect your community? Because we also know that our communities are more likely to have co occurring conditions that trigger worse health outcomes from COVID. So even if you do get a breakthrough infection, which, mind you, are rare, but there is a higher chance of something bad happening. And some things you just don't need to mess with, like COVID. I got a bunch of other things to dodge. So I've come around. And I've given you space, I've given you grace, and now some of you just need to learn to either stay home or get on board. But that's just kind of where I'm at.
Other thoughts? Thank you, Matthew.
Well, I'll say this. Justin and Justin today, in speaking with a group of friends, one friend commented to me that her significant other was on the fence about getting vaccinated, and had been for months, really for years, really. But finally, she said, they came in and they said, well, I went ahead and got vaccinated. And she was like, why? Well, I got to eat and I care about you and this child that's here in the house. So, that was something to me. I was like, okay, this is a person that was staunchly against, but now that the mandate has come in, and again, I get it. I get it that people do want to maintain their autonomy. They have that right, to make their own health decisions. But again, the concern and where this goes out the window is when your decision impacts another person's life, then that moves it out of just being about your own personal rights and goes into public health or public safety more so than just public health. This is about public safety. I liken it sometimes to talking about seatbelts. We all don't. Nobody necessarily likes them, but it is a sense of public safety.
I'd like to actually piggyback on that. It's 100% correct what you're saying. Uh, it is about public safety because I tell my patients all the time, this is your choice. You don't have to do anything you don't want to do, but personal choice is tied directly to community choice, right? So it's exactly what Dr. Carter was saying. When you make a decision for yourself, it ultimately is going to affect the decisions that are made for the community. And you liken it to seatbelts protecting yourself and the other driver should you ever get in an accident. You're not going to hurt anyone. I liken it to my body, my choice. We all know that that's a highly contentious issue. And the question is, if you tell someone that they have to have an abortion for X, Y, and Z reason, then you're taking away their choice. So and that has ramifications, and we all know that. So if you are telling someone that they have to have a vaccine, although we encourage vaccines, you tell someone that you have to have a vaccine and they say, I don't want to, they're taking away someone else's choice. But having said that, if you do say, you know, you're taking away their choice, then you have to give them other options as well, right? Wash your hands, keep a distance, don't crowd, all those kinds of things to kind of help out.
And I think those are great points from a public health perspective, looking at this akin to something like wearing seatbelts. And I just wanted to kind of set a baseline for the conversation because we get a lot into the feelings that mass mandates can create. But Dr. Furch, with your medical background, do you mind just giving us a little insight between why, based on the science, vaccine mandates have a purpose and are very important to where we are in the pandemic right now?
Of course, I'd be happy to. They have a purpose because, um, as we said, our community historically has been the community that, you know, suffers from comorbidities, exactly like you said. We're the ones who have diabetes, kidney issues, chronic, lung disease, things like that, heart issues. So we're already the communities that are most vulnerable, right? Secondary to that, we also are the communities that sometimes have, unstable housing, unstable access to healthcare, unstable access to fruits and vegetables. Lots of people sometimes are in a food desert. So because of that, we are the most at risk. And we know that, nobody cared before, if we're properly educated. No one cared before if, we understood properly, what was being told to us in school or at the doctor's office, right? And so because of that, we've had to advocate for ourselves. We have to take care of our community. So the mandate kind of, I don't like to say mandate because although we encourage and suggest that everyone gets vaccinated because it reduces community transmission, but if that's not your bag, that's okay. But it is your responsibility to protect your community, right? You protect yourself, you protect your family. It's your responsibility to protect your community. As such, you can do things. You have the other options like washing your hands, keeping a safe distance, making sure not to crowd. This speaks to social justice. There's been a lot of shift, a lot of change, lots of people gathering. Just make sure that you keep your distance because until all of us are protected, we're going to keep seeing this happen. We're going to keep seeing breakthroughs. We're going to keep seeing, memorials and things like that. So in order to prevent those exact things from happening and continue to happen until forever, you have really two options, and they both require a responsibility on your part as an individual.
I want to hop in. Without, there is something that I think it reminds me of the beginning of this pandemic, where we were like, it's got to be the Swiss cheese method. You might not get full protection from anything, but if we layer enough layers of protection on, you're going to be good. And at some point, we just like divorced ourselves from that whole thing, and we're like, everyone, just one vaccine. And like we're saying, the vaccine's probably your most efficacious, biggest bang for your buck move. But that doesn't mean you can't wrap the other layers of protection in and figure out a strategy that's going to work. But having no strategy, that's just a poor idea, especially in the way that this virus moves and this virus has been acting. So we have to figure out how do we have that conversation of if you're not going to do the vaccine, what are you going to do? And what are you going to do for yourself? And what are you going to do
Exactly.
for your people?
Precisely. That's precisely the point that we're making.
Yeah.
Precisely.
Exactly, and I like that you brought that up, Matthew. Is the fact that we did throw out. People started running. Oh, I got the vaccine. Let me rip off my mask. Let me go here, and people who weren't vaccinated, decided, oh, we're not wearing a mask. We wasn't wearing a mask to begin with, and so we still, we're left with this problem. And we really do need to sit down and talk about, okay, if you're not going to be vaccinated, these are the steps you have to take. And I will say, much to their credit on this on our campus, we have done that. In terms of their, because we have faculty, you have people who can't take the vaccine. Let's just be honest. You got people who can't take it. So you need to provide them with guidelines for what they can do. and setting up those things, in regards to not only, and I call it let's bundle, like you see on the progressive show. We need to have the COVID bundle. I got my vaccine, I'm wearing my mask, I'm washing my hands, I'm social distancing, but I'm also taking care of my health. Getting back to, well, let's think about the vitamin D deficiency that comes along. Let's talk about making sure that you have enough zinc, those types of minerals. How are you eating? Those are important things, and we do need to add that into the mix.
And specifically when it comes to mandates, I think a lot of individuals are forgetting that the Constitution, Jacobson, Massachusetts, whatever that case is, literally made it where there's precedence for our citizens in America to make it where, hey, you can't get lost in the sauce your individualism. We know you like your freedom and your liberty and all that, but that does not come before public health. And I think that now, as Black people, I feel like there's a lot of people in the community that are literally copying and pasting white supremacist right wing narratives and literally just being like X, Y, and Z. So I think that I like this conversation right here that we're having because we're accounting for various alternatives and ways that you'll be able to move and groove how you want to, but necessarily not having to conform to the man. But I'm gonna be real with you. I have a lot of irritation for people in our community that's really forgetting about all the history. When Matthew was talking about the history of our people being denied access, you feel me, to a whole bunch of things like vaccine. And you hear a lot of people throwing out, you know what I'm saying? We talked about this during our prep, the syphilis, you feel me, and the Tuskegee movement. And it's just like, hey, I think there's a lot of conflation happening for the denial of care, the denial of, you know what I'm saying, vaccines, and just throwing you out there and seeing what happens. And I feel like it's just a lot of fake wokeness going on social media and making it where shit, depending on the week, goddamn, you this week you an international therapist. Next week you're gonna be a legal, you know what I'm saying, analysis. Then the next week you're gonna be, and I think that specifically when it comes to the coronavirus and the vaccine and this pandemic, it's a lot of misinformation that does us an injustice.
I want to
I
get
actually would like to say something, if I may. I don't want to say misinformation. I want to say there's information that people don't understand. It hasn't been explained properly, and so that speaks to the way that they're interpreting the information that they're given, and then it's like a game of telephone, right? If you don't understand it properly and don't ask for clarification, you think you got it and you pass it along and along. No disrespect to social media and our local celebrities and things like that, but sometimes their interpretation of things is incorrect, and then it gets blasted and copied and pasted, right? So you have to take responsibility um, for what you take in, right? You have to use the trusted resources, cdc.gov, your local public health department website. You can find these resources. They're all online. You can go to the library. You can figure out, what are the numbers in my area? Where can I go get a vaccine? Vaccinelocator.com. Go to the pharmacy and pick up some rapid tests. You have to be responsible for the information that you take in, make sure that you understand it, and then you can go ahead and, disseminate that information for everyone else. That's what should be copied and pasted, but we have to take responsibility.
so my question to you all then is, what do we say to the individuals who don't have an issue with the vaccine or purport that they don't have an issue with the vaccine, but they may have issue with the person or the entity or the organization telling them that they need to be vaccinated? What do we, how do we approach these individuals? What do we say about that? And Marissa, I'm really curious to hear your thoughts. With you having a more on the ground perspective, just want to invite you into the conversation as well.
Well, thank you for the invitation. I think language is important. I think no matter what, if there's a mandate, if there is, there are rules and there are community agreements, if you will, however you choose to label it. I think it's about how we communicate things. I think that I like to not challenge what Dr. Furch said, I think it's a contradiction. I think that there is misinformation out there. I think there is information out there that people are not adhering to, but I also think that there is a collective of groups that have information that is just not correct. And it does come out sometimes for those as misinformation. I think there's good information there that people have the access to, the opportunity to utilize. But I also think that it's about how people communicate. I think, like, I know that it's important. This is a really important topic. I think that we always have to lead with compassion, and we always have to understand empathy. What is the other person like? Dr. Carter said, let's face it, some people can't take the vaccination. So, what other options do we have? How are we relaying? Like, I keep looking at the news, how all these flight attendants keep getting whooped or keep getting in fights on these planes. So, what is it? Is it that the people don't want to adhere to the information, or is it the way that the information is being relayed? We have to be able to have good cognitive skills and good communication skills in how we talk to people. And it's one thing because it can feel like this, versus it could feel like this, a facilitation trick, pointing versus an open palm. So it's just about how people, vibe. People want to feel good about shit they do. People don't want to feel like, and then we have about trauma. We have to think about historical trauma. We've always been told what we had to do and we couldn't do, and then condemnation. We work in a country of condemnation. If you don't do this, you can't get this. If you're not smart enough, you can't get this. If you don't go to school, you can't get this. Now, some of those are facts, but how we relay that information, I think, is extremely important.
Marissa, you are. I just want to just say you are absolutely correct. It is about the communication, and I go back to how this thing was rolled out. That was a disaster. Let's just face it. It was a disaster. Um, People didn't understand, and then they're being told. You're already panicking because you see all of these deaths occurring. You see people experiencing all kinds of trauma, and then somebody tells you, okay, we got a vaccine, but there's limited, amounts, and only certain people can get it. That sends a great panic. The other problem that I have, and I just did a vaccine clinic this weekend, with a group, and one of the issues that a lot of people are having is the fact that all you're showing is the needle. People have an aversion to the needle, and the constantly 24/7, and that is the longest horse needle I have ever seen that they show on that television. When you go and they've got the little butterfly syringe that you barely feel it. Now show that little thing, but don't show that gigantic thing, because yes, that traumatizes people. People have been traumatized since we had those big old, and I don't know, I'm older than most of y'all. So, but when we had the vaccine that left a big ring around your arm, oh my God. And I can still remember that, and I'm traumatized by it. I don't even like to look at needles.
Oh, what vaccine was that? What was that?
That's what was that? What was that one that we were getting? What was that, for
What?
polio?
There's one for
T-
polio, and then if you're international, there's one for tuberculosis.
Well, yeah, for TB. Well, see, I had to have both because we were military. But those types of all right, Marissa, you can relate. But those types of things we forget. And I'm glad you brought up the trauma. Just in that scenario. I've had students to come by and they tell me, "Oh, I'm not taking it. I'm not taking it." I'm trying to figure out, okay, baby, why aren't you taking it?
Hmm.
What's the real issue? And we got down to the point to where these kids just were afraid of I just broke them down. Okay. And they said, I'm afraid of the needle. I said, well, listen here. Do you want grandma to come in there and hold your hand so you can go on and do what you need to do? But again, these things are real. We have to recognize, that these fears are real. We have to listen. One of the things that I am always doing is, and they call me the nosiest woman in the world, and I probably am. But I love to go. I'm just sitting there just listening. Sometimes I just go pull up and sit up and just listen. look and listen, because you learn a lot from how people say things. And we do have a problem with literacy, health literacy. We have a problem with that. And part of that comes from the divide between those of us who are in the healthcare professions and in academia versus the lay person. Sometimes you got to take off all that and just go and sit down and just listen to people talk about it and think about, now how can I explain that to her so that she understands? Because again, it's nice to have celebrities, going out and saying this and that, but sometimes people tell me, I don't know this person.
I
I
mean,
know Miss Ann down the street,
yeah.
but I'm sorry, I don't know this person. Yeah, I seen them on TV and I seen them, in this movie and that movie, and that's probably just another role somebody done paid them to do. But we know ain't nobody paid Miss Ann and her children. So listen to Miss Ann, listen to what she is saying and how she's saying it. Because it's what she says that's gonna get across. And sometimes we have to bring them into the fold, make her a part of the conversation. Again, the best advocates for vaccines in this community are the people themselves. I go straight to pastors, your barber, your beauticians, the people at the car wash, and
Yeah, I
straight
think
to them.
I think part of the issue is that because there's so much distrust in our community for different authorities, specifically the medical field. I think that even when we have black individuals that's put blood, sweat, and tears into becoming Dr. Carter or Dr. First and this, that, and the other, there's just a big distrust. And I know from being consciously on the internet, there's a lot of people in the conscious woke community that automatically start using narratives and language and rhetoric of coon and sellout and conforming and assimilation when we start talking about things that are a part of, you feel me, like mandates. You see what I'm saying? So I think that there's to answer that question, you feel me, at lowest pose, I think that there has to be a healthy level of skepticism. But I think that that skepticism cannot make it where we throw out the baby with the bathwater, or make it where I'm now going to use my skepticism to determine the entire perspective that I have on this right here. I think that if you're being real, I think that black people, we know, you know what I'm saying, it's ways that we get messed over, but I think that we have to be mindful and take a full accounting, you feel me, what's going down, and to make sure that we not taking the short end of the stick out of our own suspicion, our own skepticism. You see what I'm saying? That's what I think is going on. Because it's like right now, I've been told, hey, you got the vaccine, hey, that's for sterilization. That's for, you know what I'm saying, population control. Like literally, I'm on Twitter. You feel me? I'm about to read a tweet. You feel me? This right here, and it's millions of these. Hell yeah, the vaccination is only to alter the DNA of human race. There's one way to get out. Since we all were babies, these vaccinations have been mandatory, and that's why some of us have health issues and allergies and shit. As a human being, I'm not supposed to be allergic to fruits that come from the earth. There is multiple of narratives like this that are pseudoscientific, that are literally popular. You see what I'm saying? I'm talking about so popular that if I say the word vaccine, I'm automatically dealing with why I have a hand growing out of my ass because Bill Gates said so. You see what I'm saying? And that's what I mean by misinformation. Not trying to be facetious at all or
No,
condemn at
yeah.
all, but being real and recognizing that these are real narratives that are way more popular than I feel like, you know what I'm saying, we give credit for. You feel
So
me? That's what I
I'll
was
start
saying.
with that. I think one I always like to say, as someone who works in the political sphere, is to remind people that Twitter is not always real life, but things do happen on Twitter. And we know that bad vaccine science happens on Twitter because the New England Journal of Medicine literally had to troll Nicki Minaj because of her Twitter comment about how her cousin got sterile because of getting the vaccine. So we know that fear is out there. But I think it's about, as things Dr. Carter was saying, we gotta talk about how we roll these things out. How do we get people to think about vaccination? The way we got your kids vaccinated is because it's about protecting kids, protecting your community, your children. That worked for people, and you got to find what resonates with those people. And by those people, I mean literally the people sitting next to you. Because my brother did not get vaccinated until July, and the only reason he got vaccinated is because I refused to pay for his plane ticket to come to my aunt's wedding if he didn't get vaccinated. And
Sometimes that's
so
what it takes.
yeah, you've gotta find your ways in. He's like, well, I just didn't have time, and he's like, I don't do anything right away because you got to wait to see where the data comes. And I go, there are 250 million people in this country who've gotten a vaccine. You think that they're trying to sterilize all of them? All of them. Let's just sit with that for a second. And
Well, let's also ask this question. I'm asking this to the group. Does everyone know what mRNA vaccines are?
I think that we are.
Poquito,
I
poquito,
think.
poquito.
I think that we are. And hello, everyone.
Hi, Dr. Wallace.
um, I think that when we consider communicating medical information and we don't actively work to build bridges to help people navigate and reconcile the very that that consciously brought up, I think we are doing a disservice. And honestly, people are receiving us as disingenuous. And I think that though these particular situations may feel much larger than life, much larger than all of us. I think it's part of what we signed up for when we said that we so and so director of this, so and so CEO of that, so and so health policy expert this, so and so PhD MD. So I think that we need to do that work and recognize that, as you mentioned, that these things come from a very real place. I'm supposed to be moderating this. I apologize for my tardiness. It sounds like the conversation has been amazing so far. My flight was a bit, but I want to adjust the framework of this actually and bring Lewis back on screen. And I think it's important that that we do talk about what mRNAs are. I think it's important that we talk about what they do and specifically what they don't do. But that explanation will then get read through the filter of some of these other issues. We don't also unpack and talk about that too.
Correct. That's exactly why I brought it up, because of these myths that are out there that, and it goes back to our conversation of information that's not communicated appropriately, or the understanding check hasn't happened. So then we get that game of telephone. If you'd like, I can explain it now.
Go ahead.
Okay.
I'll take it definitely.
Okay, so mRNA vaccines have been around for decades, like 30 years, at least 30 years. And we use them all the time. Flu vaccine, that's a type of an mRNA vaccine. There's different kinds, but that's one. If you guys remember Zika virus, that's an mRNA vaccine. We use it in Ebola virus, things like that. So these are all mRNA vaccines. And basically the M, and we think it's, it's going to affect our DNA because mRNA, DNA, it is its counterpart. However, the M just stands for messenger. And what it does is it sends a message to your cells that say, hey, make a piece of what coronavirus looks like, right? This is what we call non-self, or an antigen in our immune system. That's how it recognizes it. And so when that happens, our immune system says, hey, this is not me. This is not supposed to be here. And that elicits our B cells and our T cells, right? So that way, whenever we see, so our B cells will come around and they'll react exactly to that part of the coronavirus, right? Which is the spike on the edge of the virus, which is why it's called corona. So our B cells come and they attack that so that the virus cannot lock onto our healthy cells in our body and make us sick. Create more virus, destroy cells, keep going, and then you get sick, right? Our T cells get those cells that the B cells didn't reach in time. So they are already chewing them up and then, getting rid of them. So what stays in our body are the B cells that the vaccine has triggered to clone themselves, right? So now we've got that going on in our body. So the mRNA part, it disintegrates and it is absorbed in our body, and it doesn't even affect anything. It's literally just the messenger to get our body to kickstart our immune system that says, should you come in contact with this virus floating around, you have a way to protect yourself and make it so that your symptoms don't last as long, make it so that you can clear the viruses and get better faster so that you can't be spreading virus to other people. So should you come in contact with someone and you have on your mask, you're protecting them from your droplets. You stay back from people, you keep your distance because it makes the virus kind of disseminate in the air. It doesn't last very long. So that's what the mRNA vaccine does. That's how it works within our immune system. And I'm telling you, it's been around for ages. So for the ones, I know there's a lot of myths out there that are saying, well, I'm going to wait. They're experimenting on us. They've been experimenting on us. We all remember Tuskegee. We all remember, all the nonsense and ridiculous things that were wrongly done to our people. This is not an experiment. This is a tried and true method. It's called the scientific method that we learned, back in high school and in chemistry when you're learning about science and all that. But yeah, so this is a tried and true method that we're using on a new virus that, we're seeing success. It's behaving, the vaccine is behaving exactly like we planned it to. So there's that. As far as you're going to be sterile now and this, that, and the other, there's no way that could possibly happen because the virus is infecting your immune system, right? The vaccine works with your immune system to kick out the virus. In no way, shape, or form is it going to your reproductive organs. So there's no way that can happen, okay? So you can't become fertile. It doesn't change your DNA because it doesn't work with DNA. It works with your immune system. So I hope that kind of helps to alleviate some of the scariness.
Thank you.
I often
Thank you
liken
so
it
much.
to think of like you are an undercard fighter and you're getting ready for a prize fight that you don't know when you're going to get called up for, but you have a training partner who's really good at training you, but you get called up for the big fight, i.e. when you meet the virus, and your training partner has gotten you ready, but no one remembers the training partner when you win that belt. Just like your MNRA disappears, no one remembers that, but you did get that fight because you won, because you were ready.
Exactly. I tell my patients, it's like learning how to swim. You have to get your immune system together, but you can't just jump right in the pool. You use floaties first.
Thank you for that.
Come through analogies. I love it.
Thank you so much for that wonderful description. I think that was amazing in such a short period of time as well. But I wanted to make sure that we also think really long and hard about the people who have the information but are struggling with how they feel. We're struggling about taking this not necessarily as it's not necessarily a matter of knowledge, and because we've been giving people great knowledge. I've been a part of just about every single episode of COVID in Black, and we've had some fantastic experts on, just like we have fantastic experts on tonight. But more and more when I go out in communities, I see people and hear people that are struggling emotionally with taking this vaccine, that are struggling with feeling like they're being told by a government that they don't trust to take a vaccine that they are still kind of coming to grips on. There's a lot of new science going on for people, I would say, or scientific terms that they haven't heard before. Many of us in vaccine research are familiar with these terms, but many are not. So I just want to talk more about how do we address this? How do we bring to people's consciousness information, or just how do we wrestle with people? And I mean that in the best way, as they're wrestling with their emotions around this vaccine.
I think I'll say one of the things that I think is really important to me is that you listen and that you hear me. And I think so often, like active listeners' mouths are not moving or their bodies are positioned, postured, if you will, to hear and to learn. And it's important that people are postured to hear the information and the the hesitancy that people are having or experiencing them. You know, yes, we know that this is something, that they have to do, that they must do in order for us to what they call herd immunity or whatever you call it. But I think that we have to hear people. I think we have to hear people. We have to understand real life situations. We can't always use our judgment, and some of it's not a professional judgment, some of it's our personal judgment that gets mixed up with our professional judgment. And I think we just really have to hear people, and we have to also prevent people from attending things. I'm telling you, like, we are not allowing you in the building if you are not vaccinated. I'm sorry. And we are beginning to check the authenticity of vaccination cards, because what people are doing is when they can't attend something because a vaccination card is required, they are versus getting the vaccination, they are getting fraudulent vaccination cards. And so I think listening, hearing, and if you don't have a solution, don't offer one. I think the worst thing that you can do is offer information that is intellectual or is false information, because that is how the misinformation does get out there. I think listen here, and if you don't have the answer, point them in the direction for the answer. But I think just listening and hearing people, and then probably helping them process some of those fears, past traumas, anxiety, everything. Like when I was in Walmart and got my vaccination, I got my vaccination at Walmart, both of them. It was this little box, like right by the pharmacy, you know, I have a compromised immune system, so they're asking all these questions, and I'm like, how do I talk about me with the person standing so close behind me? And even the space where they gave the COVID test when COVID was in its height, you know, and vaccinations were being offered was too close for comfort, you know. So I think, I'll share this and I'll be quiet. One of the things we're going to do this Friday. But I'm totally against it, but I'm going to participate because I don't think TDOR should be utilized for the purpose. But we're going to partner with the Marion County Public Health Department to offer vaccinations to the trans and non-binary community. We're going to take something that is negative and celebratory, but we're also going to offer education, and we're going to do it at our house, Translutions. We're going to do it at a place that we think we want to see. Do people feel more comfortable coming into this particular setting, you know, where some house music going on and there's some food going on. And, they might even be in the back. I'm sorry, Dr. Carter, on the backside, smoking a little reefer on the backside, but they're there. We have mobilized them. We have got them there, and we are going to feed them, and we're going to make sure they have the vaccination. But we're also going to have an outreach effort to come back so they can get their second shot. So we're just gonna try to see what works. I don't think there's one perfect answer of work. I think this is why we have these fantastic conversations of collective thoughts. I think we talked about it takes a village to raise a child. I think it's going to also, for us, take a village to disseminate information that is effective in our communities and accepted.
Well said, Marissa. Any other thoughts?
Yeah, my motto, education is elevation. The way Dr. First just broke that down gave me a whole bunch of understanding and context about mRNA. You feel me? Make it where now I feel like confidence to go back and go read a little bit and then be able to regurgitate some of that information, and recognizing that I come from a background of like traditional black radical stuff. So when it first started rolling out, I was one of those individuals like, oh, hell no. But I think that the way that I feel like I thirst for knowledge and thirst for information, that I was able to go find it. You see what I'm saying? And I know that for me, talking to people that, what I'm saying, when I'm in the hood doing what I'm doing, or, what I'm saying, talking about family members of the homies, I find it very efficient to talk about the history of vaccinations and to be able to give. I feel like what Doc above me this was able to give. Like, hey man, I'm born 1990. In order for me to get to my university to enroll, I had to show them my immunization cards. I think that it's kind of disingenuous now for us to act like the vaccination is the boogeyman when I recognize we've been getting vaccinations throughout our lives. And being able to, I think, relay that with compassion and being able to listen to hear the rebuttals and go back and forth, I think that has been the most effective, and not make it where I'm coming in as I got two master degrees, I work for the university. You better listen to me. Shut up, nigga. You don't know what you're talking about. I find that if I come off it that way, any way, shape, form, or fashion, they say what I'm saying. What Marissa's saying, you feel me? Like, hey, you don't. It don't come off as being genuine, and you come off as being condemning, and you create a superiority complex. I'm the magical Negro that's educated, and nigga, you don't know what you're talking about. So listen to me. I think that type of dialogue is not conducive to education, and it's not gonna bring somebody around. But what I do feel like being able to just show people information. Like I also, last thing I say, I posted a video. You feel me about where everybody, and no matter what community you come from, you respect Muhammad Ali. You know Muhammad Ali was a real stand-up dude, right? I'm showing this video of Muhammad Ali saying, literally getting paid from New York, you know what I'm saying? Places like, it's the law. We gonna get vaccinated for measles. He naming it. He literally naming it. He's saying like we want our kids to go to school. You feel me? And when I posted this on my page, I was kind of caught off guard by how much, you feel me, man, beef that the post got. And it just made me think about, hey, y'all don't know what y'all talking about. So I ain't gonna hold it against you. I'm gonna try to be an educator and put you on this information. If you like it, you'll be on to it. If you don't like it, then it is what it is.
That's a great point. And if I may, it also speaks to our conversation earlier about individual responsibility being tied to community responsibility, right? You're putting these things on there that you've looked up, cdc.gov, your Department of Health, these are the kinds of things that are appropriate to copy and paste, right? So if we make those kinds of connections, which we do all the time, we do it with, an individual's choice in and how that affects the community with politics, with education, with our economy, et cetera, with everything you can think of. So if we're so willing to do that, we can't be afraid to assign that same sort of responsibility to getting vaccinated and educating yourself about the vaccine, because you can't just cherry pick the things that make you look good. You have to take the good with the bad, right? And speaking of, and I really wanted to, it's holiday time, and I just want everyone's going to want to get together. It's off topic, I realize, but just have a plan, everybody, because the the breakthrough cases that we've been seeing lately are like you can be fully vaccinated and still have a case of coronavirus because things just happen. No one plan is foolproof, right? So you have to take precaution. Ideally, yes, we get together during this holiday, everyone's vaccinated, and you can be cool. But in the meantime, just quickly, mask up until mealtime, right? Say your hellos, open up those windows. It might be cold, but open them up. Have people who might be more vulnerable sit together next to the window, something like that, just so that, they're not so concentrated. But wash your hands, keep a distance, take responsibility for yourself and your community, and protect each other, love each other. This is what we do. This is how we've always survived. We look out for each other. That was off topic, but I wanted to say it because Thanksgiving's literally in a few weeks.
Thank you. That was awesome. So one of my last questions I'll pose to the panel is, we've talked about community responsibility. We talked about addressing what a lot of people would term vaccine hesitancy, with grace and care and listening. What if I'm the type of person that I'm not afraid of getting COVID-19? What if I have family members, for example, that have gotten COVID-19 before, and they don't see a concern with getting a vaccine anymore? They don't feel like it's their responsibility to to get vaccinated for the community because they don't feel like it's a real community concern. So how would we engage people like that?
So I follow this in two lines of thinking. One, and it's how I feel about public health in general. You can't save everybody, but we can save a whole hell of a lot more than we're saving now. And so we can make structural things, we can make inroads to get people information. We can do what we can, but you're not going to save everyone because humanity. And that's why we always say in epi, we're like 70% gets us to herd immunity because that's actually some natural infection in there, and then some people who can't get it covered, it all kind of lumped in. Second, which is also equally important, is I might not be the best messenger for you to hear from. So I might come to you with this, and you might just be like, whatever you say, Matt. And yes, I am a magical Negro, but I might not be the magical Negro you need to hear from. But my job is to make sure enough other people know where someone you hear from has something that sticks to you. And some people are going to make that informed no. And that's going to be the reality. But with the way the numbers are, with the way the things are at, we can be doing a whole lot hell better than we are doing. And I'm focused on those folks. I focus on everyone I can save, everyone who needs saving, and I'll make sure the door's propped open, there's a chair there, and there's a warm meal on the other side when you're ready to come in.
Thank you, Matthew. Well said. Any other thoughts?
I'm just pondering what you're saying simply because I run into it all the time, and especially with the younger, dealing with college age, and that what I call that 18 to 45, 50-year-old bracket. And what I'm finding out is many of them, number one, they don't think that it can get them. Well, that's something, when it rolled out, that was for them old people, and my immune system is, in charge, and I don't think I can get it. And because we had a couple that were former alumni of the university, um, and they were of that mindset. And guess what? Now they got three children that are orphaned. I try to talk to that age group and try to show them the data where it shows that those who are dying and those who are getting sicker are younger, not older, being diagnosed with COVID. And I asked them, yes, you probably have had it and you survived this time, but understand something: those antibodies we don't know how long they last. I mean, that's the reason why we're talking about the boosters. So I just try to impart that to them and at least get them to think. I may not get them to change their mind, but I have exposed them to another line of thought in regards to this.
I agree. And not just, antibodies don't last, we make those memory cells that kind of stay with, but the boost definitely helps, right? You have to kind of think about it that way. And as until everyone is protected, until we reach that herd immunity level, which it's higher than 70, each that's an interesting thing that we don't really talk about that much, but for coronavirus, it's upwards of 85, 89%, just because of the way that this virus it mutates and things like that. But you want everyone to have this information, and you want everyone to get vaccinated, ideally, because until everyone is, you know, we're going to just keep having this, all the time, all the time, all the time. So I understand vaccine hesitancy, but we can do these things that we're doing right now. We're coming to our community, to our patients, to our friends and family with that open hand, lifting them up, giving them this education, giving them resources, and we just have a conversation about it.
See, y'all a little more nicer because in my mind it's just like now we got metaphors and analogies, and it's just like coming from the hood. You ain't got to be scared to get your ass whooped. You see what I'm saying? And going back to that seatbelt metaphor, it's like, hey, so if you got into a car wreck and you survived and you didn't wear a seatbelt, what you're telling me is you should not wear a seatbelt because you survived the last time? Your logic right now seeming real faulty, and then just going leaving it. This is from the analogies, and it's talking about the actual like pandemic, the actual like vaccine. I think that that is what causes the variants. That is what makes it where you feel me, the immune compromised individuals now have to worry about your big bold badass. You see what I'm saying? You like grandma? You going to is you going to Thanksgiving? So hey, yeah, cool. You don't care about you, but if you want Granny to make it the next Thanksgiving or Grandpa, I think you gotta switch the energy up. And that's why I was talking about folks about being lost in the sauce of individualism or lost in the sauce of an individual agnostic. So you gonna take your bravery and courage and liberty and put it before everything? The Europeans taught you well. Capitalism has taught you well. You feel me? White supremacy got you. You feel me? And that's how I feel with that. Like you ain't gotta be scared of your ass whoop.
So to put this in the context of anti-racism, one of the things that I think when we talk about Black communities that doesn't get mentioned very often when we talk about mandates is the autonomy of the Black body. There has been a lot of work done within, I would say, the past few decades to reclaim autonomy of the Black body. And that goes for Black cishet people, that goes for Black queer people, that goes for Black trans people. There is more awareness than ever of the autonomy of the Black body and how the Black body has been treated now and how it has been treated through history. So how do we reconcile vaccine mandates with this idea about autonomy of the Black body and looking out for each other in the Black community?
So I'm going first. I'll be short too. White supremacy and white people don't corner the market on medical, you feel me, care. You know what I'm saying? And I think that if we really trying to be pro-black and be activists and be revolutionary and really think about black autonomy, I think that we should not rob all these black experts that surround me right now, not rob y'all of y'all professional autonomy because we think the big bad white man is always already there. I think that that's what gives us a disservice when we start to believe that white people have cornered what it means to give vaccination or corner what it means for you to take healthcare. And I think that to me is anti-black.
Let me say this. We continue to sometimes hurt ourselves, especially when we want to basically blame all knowledge and understanding of anything to Caucasians. And you forget, the first people on this earth were Black people. When you talk about medicine, you got to go back to Imhotep, okay, the god of medicine, and the papyrus. Okay, it wasn't something that he was just thinking of and never wrote down. It's there. It's there. It's readable. It's published. Come on, and we can't continue to deny this. And also, you look at the young people who were actually in the labs working on this virus. Happened to be one of the veterinarians who was doing the first trials on this particular with the Moderna with the mRNA was one of our Tuskegee students. Then he took what he had and transferred it to Dr. Fauci's lab. So these are Black people all along the chain. Okay, it's not like all of a sudden that we're jumping in there and coming out and just saying you need to take this snake oil. No, we're the ones who are in the lab. We're looking at it. So stop being ignorant. I'm sorry. It just oh, it bothers me.
Thank you so much, Dr. Carter. So we're about an hour into our conversation. I want to invite our audience. We have about 30 minutes left. So I want to invite our audience to please submit your questions and comments for our panel in the comments section of wherever you're watching right now. Please, we'd love to hear from you. So with that, I also wanted to invite Dr. Wallace to share his thoughts. I know that he has been looking very, very intently. So I wanted to see if Dr. Wallace, did you have any thoughts to share in the conversation?
I see you. I see you, George. um, I just did a talk at the Association of Nurses in AIDS Care annual meeting in DC last week, and I'm reminded from many of the conversations and the questions that came up during that talk, the room full of nurses and healthcare professionals, that everybody is not in the same place in this process, not just in terms of community, but also within the healthcare sector, right? And, you know, we talk often about the fact that this is probably one of the first times in recent history that science has been under the spotlight and really in public display in the way that this has for the COVID-19 vaccines. And I think that that's a good thing. One of the things that I would encourage to sort of dovetail off of what Dr. Carter mentioned and what Consciously mentioned, and as well as others, I'm sure, this is an opportunity to not step back. With respect to concerns, with respect to the challenges with respect to the systems and all of that. To me, this is an opportunity to actually step forward. This is an opportunity to step forward and get involved and get engaged, recognizing that for every question that exists, there is an answer. And being able to seek the truth of the reality and of the questions and that are out there that we continue to hear, I think is really important. And to sort of dovetail off of the disservice comment, I think it's a disservice for our communities to have concerns and for them to not have opportunities to have them addressed. So, for folks who are out there, if you have concerns, find people that you trust who can have the conversation with you. Um, for those of us who are doing this work, as well as those out there who are anti-science, I would just ask that you consider getting out of you're out of your echo chambers, right? Like it's time for us to it's time for us to begin talking to other people. And that means adapting our communication style and our language to ensure that our messages are being heard. But I just wanted to say that to me, this everything that I continue to hear, that I'm in, the conversations that I'm a part of, not just in the professional space, but also within my own family. I have family members who were not at all into this. And I'm like, you do know what I do for a living, right? Like you do know that this is literally what I do. And I have family members like, yeah, but I just don't trust. I said, so you think I went and spent all this money on all these degrees to sit here and carry somebody else's message? um, so I'm like, yeah. So I was able to help folks make the connections and build the bridge to understanding. And again, part of that is by meeting people where they are with their concerns and recognizing that as many times as I hear the microchip and the 5G and all this, I sometimes it just makes my head spin. But at the same time, I feel like, there are people out there for whom even this conversation that we're having right now, this is the sixth COVID in Black. And, the largest one that we had reached over 400,000 people. That's still nowhere close to the number of people in this country, that Black people specifically, right? So there's still pockets of Black people that with messages and information from trusted sources, and they're getting them from the memes and from the social media and from the sound bites from those on the other side of the conversation. So I think it's time for us to continue to invite conversation, continue to invite questions. We're not going to get out of COVID. COVID's going to be around for a while. Even when the pandemic subsides, COVID is still going to be around for a while. So we have to deal with it. There's no reason to sort of avoid it.
Thank you, Dr. Wallace. I really like your comment about pockets of Black people, because it helps us to acknowledge that the Black community is not a monolith. I think that's something that we all know by now. And so I'm just curious, we have people on this panel from all different parts of the country. We have people from the Deep South, we have people on the West Coast, East Coast, I just want to get your thoughts on how can we address this in the communities? How is this different in different parts of the country potentially? And what are some of the tools that we have in these different parts of the country to address the way people feel about vaccines and vaccine mandates?
Does that mean I go first?
That,
Well, I can say that as a Black female physician, um, being in Brooklyn at the beginning of it all, and not knowing what was in front of us, being able to see that everybody is just sick and everyone is just ill and it's not stopping. Um, and just seeing that, and it does take a toll on you, but you have to meet each patient with compassion. You have to meet them where they are. You have to um, have the conversation with them and help them to understand what's going on in the world, right? And what's going on with them and how this can affect their family and their community. And then seeing it again in Arizona, where it legitimately is the wild, wild west, and everyone's like, I don't need to wear a mask. I don't need to do anything that you say. Black, white, Hispanic, it doesn't matter. They're just like, I can do what I want. Again, having to meet your patients where they are, um, have a conversation with them, explain things, give them resources, give people back their autonomy, and that's the key to healthcare. That's the key to public health. It's it's going. This is going to be with us forever. So we have to learn ways to protect ourselves and learn ways to protect our community because it's the only way. I looked at these statistics today. Black and African American, non-Hispanic, 1.1 times more cases than the national population, 2.8 times likely to be hospitalized, 2.0 times more likely to die from COVID. This is today. I'm on cdc.gov right now. It doesn't have to be that way. Let's have our conversations with our people. Let's be responsible for the information that we put out. Let's be responsible for understanding the information that we take in and meet each other.
Yeah, I think that context just requires a lot of uniqueness. Being somebody that lived down south, born and raised down south in the Bible Belt in a red state, I feel like a conglomeration of a lot of different things. You feel me? We know that down south, there's a lot of different pre-existing health conditions that rely, you feel me, in our culture and how we eat and cholesterol and all this type of stuff. We know that impacts how we gonna deal with the coronavirus. We also know that in the Bible Belt, we have a lot of ideas that we can just pray it away, or that our faith and our deliverance is going to be able to, you know what I'm saying, get us out of what we got going on. And then we also have the mere politics. You feel me? Born and raised in Texas, now currently live in Oklahoma, and just recognizing whether I go home or I'm in this state, there's a lot of conservative politics that also apply to the pockets of black people, especially down south. You feel what I'm saying? Where it make it where a lot of the things that our conservative counterparts are saying is literally seeping into the pockets of the black community. And now we have to disseminate those or deal with those when we trying to have dialogue and create conversations about how those statistics that doctors read, how it's more unique for us. You see, you know what I'm saying? I think that when it comes to doing the approach, what I find when I'm, you know what I'm saying, when I'm down here, that's really what I try to account for. I try to account for the pre-indoctrination, the pre-conditioning, and how we always already been like, I'm gonna pray it away, man. I'm a believer. God got me. You feel me? I'm finna go eat meat this over here, and you know what I mean? Them liberals or the government, this, that, yeah, because you gotta recognize that a lot of the the left and the right gives institutional critiques. A lot of people in our community just hear institutional critiques and we jump onto it. So a lot of times there are a lot of white supremacist conservative criticisms for the institution that people in our community don't hear it as that. You see what I'm saying? And we just copy and paste it. So what I find is just being real and then making it where I try to hear people, and I'm a debater. And I find that most people really like to debate only if you're willing to respect them as a debater, hear their position, and really have compassion and listening to them. And I feel like Marissa said the realest thing that I'm gonna take from this is just like, and I think my wife be telling me this all the time too, and I feel maybe that's why it's hitting like this. I gotta posture myself in ways to listen. You feel me? That's just some real shit, man. But I digress.
Any other thoughts?
I just want to say you didn't digress. And as physicians, we do have to humble ourselves when it comes to meeting that patient. You know, it's it's exactly what Dr. Carter said. White people don't have, you know, the right to vaccines more than black people. White people don't have the right to health. Health is a human right. So let's live.
And I will comment just a bit. I think what white people have more than black people have is experience and access. I don't think historical access. I don't think when we're talking about the vaccination, I think the vaccination is available and the opportunity is there for everybody. But I think this mindset, this historical mindset that we have been, my brother calls it the oppressive ways of thinking or white supremacy. I'll say this: when I go into a doctor's office, I like to have conversation that I understand. So I think that the way that we are really going to continue to get the vaccination out there is to move our conversations to community conversations. Now, how we move to community conversations, I don't necessarily know. I know that we've got to involve community to do it, and we've got to be able to take this information that our academics that have put all this work, Dr. Wallace, with all the work, all the degrees that you have accomplished, how do we get that information and disseminate it? uh, you know how to bring it in a community perspective, but there's not many that are as fortunate in navigating conversations from an academic perspective where lay people understand it and they feel it and they trust it. So I think it's about taking the language that is there with all of the facts, all of the statistics, and moving it to more of a community narrative.
Thank you so much. So it looks like we have some questions from the audience, and I want
I
to.
just want to comment on something that I read really quickly there. There's no live or dead virus in the vaccines. I just want to reiterate that again. It's come up a couple of times in the comments. So you're not going to get COVID-19 from getting the vaccine. That's not how that works. Recognize there are some vaccines that are developed using different parts of the virus or different parts of a laboratory based or a manufactured version of the virus. But what we're talking about with COVID-19 is pieces that are manufactured in the lab and not live virus, not the whole virus. So you won't get COVID-19 from getting vaccinated.
You know, there was a myth about the flu shot. When you get the flu shot, they're shooting flew into you. So again, misinformation that we take and we run with it, and there is no live flu in that either. Am I correct, doctors?
That's correct. And that feeling that you feel after you get your vaccination, that's your body working. That means you're alive. You want that to happen.
And everyone's body is different, so everyone is going to respond to that. And the other thing that I want to say that was brought up in the questions is that there is a reporting system to track adverse events or reactions that people may have to the vaccines. The CDC VAERS program is publicly available. I would caution that when people go to that site, uh, that they don't assume causality for the different events that they see there. So just because something is a part of the story doesn't mean that it was the cause of, right? And that there can be this thing that we call association. There can be something that's connected to something, but it doesn't mean that it was caused by that thing. So I think that that's really important that people know that when they go to the VAERS website and look at the data.
Thank you, Dr. Wallace. I think that addresses many of the questions and comments that have been coming up in the chat, as far as I can see. One thing I do want us to talk about before we log off tonight and consciously, I think you brought this up, was politics. I don't think you can talk about vaccine mandates today without talking about politics, especially in different parts of the country, because vaccine mandates in some parts are much more political and than they are in other parts. So, how do we expect Black people to navigate this political landscape that we're in right now, on top of COVID, on top of social justice movements that are going on? And particularly, Matthew, I would love to hear from you, considering your background in policy. Um, what do what do we expect of Black people when it comes to politics today,
Well,
especially
first
knowing
of all, I
that
want to. Oh, go ahead, Lewis.
I
What
was
do you
just
say?
going to say, especially knowing that people have been taught, sometimes the only thing about politics that they've been taught is not to trust the government, not to trust politics or political leaders.
I mean, we'll go back with it. Let's start. Let's do a little history education. One of the worst things that ever happened to this country was when Ronald Reagan uttered the lines, "There's nothing scarier than someone knocking on your door and saying we're from the government and we're here to help you." That popular opinion has filled our ethos about how we view government and government programs. And as long as the program says it comes from the government, like you don't know the name, then it's bad. But if you ask about the actual program itself, wildly popular. Actually, vaccine mandates are wildly popular across political lines because people are tired of COVID. People are tired of COVID and they want it done and over with. And they think at this point, a lot of people are like, I've done my part. Why haven't you? And so, you're still seeing pretty high popularity, but at the end of the day, public health should never be about politics. And that's one of the worst things that happened. Like it became a sign of like what side of the political aisle you're on to wear a mask or not, we knew we were having problems. For fuck's sake, a member of Congress has forfeited one third of her salary in fines for not wearing a mask on the floor of Congress so she can be that political symbol. And for what? Why? To show the American people that it's bad for people to protect themselves? Like, this is not helpful for us because the virus does not care about your political alignment. It doesn't say, hey, who'd you vote for last election? Because depending on what, I'll decide what variant I give you. No, girl, she walk in and she say, I'm Delta, I'm faster than everyone, and I'm coming through your front door. Now, maybe not through your front door because some of you don't have a lot of people over. Kudos to you. Keep that protection. But needless to say, we like to in this country make things be about red issues and blue issues, and health just can't afford to be one of those because you know what no doctor is going to ask you or no provider will ask you when you walk into the hospital or the clinic or the ER your political affiliation because you just need care. And that's what it's about. And so we have to remove the political side because the longer we sit in it, the worse it gets. And we should also stop acting like politics is always something that happening to other people. People be making decisions about your lives without you being involved in the political discussion. So at least be in the discussion long enough to decide what's happening to you. If you don't like a mandate, if you don't like a plan, hold your people accountable. Tell your elected officials that they need to tell you what protections they're putting in place, what they're doing to meet their obligations to you as a voter and as a citizen. That's part of the social contract we make here. So if that's what you're going for, yes, but it's important. Politics does govern things. There is money that came down the pike. We put a whole bunch of money into our economy. We extended a whole bunch of social programs. We learned that, oh my God, if you give poor people money for their kids, you can cut child poverty in half. Wow, novel concept. If you give people free vaccines, they still won't get them, but at least when they're ready to get some of them will get them. Oh, maybe healthcare should be free too. Oh, weird concept. It's actually none of this was free. All of your tax dollars paid for all of this. So congratulations, your taxes paid for all the things you've got now. All right, rant over.
Well said, Matthew, as always. Any other thoughts about how should Black people navigate the politics of today?
I know Claudia Gray over here asking, how do we reconcile hesitant with vaccine equity? It's pervasive in Caribbean and Africa. And I just think about, you know what I'm saying? My man Huey P. Newton once said we got to think globally and act locally. And I think that just taking on that narrative, recognizing that we have a global, you know what I'm saying, a global community, and recognizing that there's an African diaspora and we disperse throughout the world, and recognizing that there's different access and different infrastructure based off of the nation that you're in, and being able to recognize that black people throughout the globe have been messed over in some way, and that we all have, you feel me, some healthy skepticism, you know what I mean? But specifically when it comes to people like people in the Caribbean and Africa, really trying to go to those communities and think about what they really saying, what they really doing, and making it where we take some copy and paste from Marissa, you feel me? We need to come and bring some food, bring some music with you, have individuals that speak the language of this community, that speak the slang of this community, to be able to speak, you know what I'm saying, speak to these folks in this community. You feel me? That's what I think. But I see y'all in the comment section talking y'all shit. Listen, man, we having a conversation. You feel me? And I'm trying my best to get into the conversation in the comments because I'm a content creator. You see what I'm saying? But yeah, I tried to answer that question right there. Dr. Wallace, though, somebody had something for you real quick. What is actually all three of the doctors over here? This comment right here. I seen one in the comments. I know we ain't said it yet. They asking the question, what are the long-term impacts of the vaccine? And I feel like that's one I want to know personally too. So shout whoever
before
answered.
the doctors answer that, let me
I
just
just want to
quickly.
get to the global access piece really quickly, and just add that the global access to COVID-19 piece, particularly on the uh, it's something that absolutely needs to continue to get some attention and some work. Most of the continent does not have access, so this is not even a consideration of hesitation because many people want the vaccine. However, if there is no vaccine for them to have, then that's part of the issue. So the U.S. government has donated vaccines to different countries around the world. However, it's not enough. To do with scale up the transferability of the technology used to develop these vaccines in these countries, build up their capacity to do this work so that they can produce and manufacture the vaccines locally and to disperse them and distribute and get them out to communities easier and quicker. We already know what that's about. So.
Yeah, the one thing I would tell people to follow is People's Vaccine Alliance. It's an international collaboration of folks working across the globe trying to get access to COVID essential technologies in low and middle income countries.
And in terms of long-term, effects, Dr. Furch mentioned earlier, the mRNA vaccines don't stay in our bodies very long. The protein and DNA-based vaccines don't actually stay in our bodies much longer. And so the vaccines don't stay in our bodies long enough to have long-term effects. What we're doing with the vaccines is basically better recognize or identify and fight off the virus when we encounter it. There is some information out there about some of the adverse events or the side effects, the reactions that people have had. For example, anaphylaxis or severe allergic reaction to some of the mRNA-based vaccines, and severe blood clotting and heart inflammation, and some of these other things that people have seen. In these cases, to be clear, we're talking about like 10, 15, 20 people out of millions of people that have been vaccinated. So, and also just for clarity to the question, because I think that's a really important question, we don't typically see long-term impacts from vaccines. Like this is not something that we typically see in the medical field. So that's a really important consideration. Now, there are, of course, we're talking about millions of people. So, eventually we're going to see something as things pop up. And we're seeing these reactions, as I just mentioned a moment ago, right? The heart inflammation, the severe blood clots. And as we continue to see things which are being tracked in the VIR system that I mentioned before, if we're seeing things that impact the clinical guidance, indicating that these vaccines are safe and that they should continue to be distributed, then the clinical guidance will be updated accordingly.
So I want to thank you all. We're coming up on time. This has been a fabulous conversation. I'm really happy to be a part of it. And so I just wanted to take some time to go around to each individual and get some closing thoughts from each of you for our audience today. So I'll start with Dr. Carter.
Well, thank you. I think for me the main thing is that we need to think in terms of humility when we're talking with people about this vaccine, and not put it in as a either or situation. And we need to also recognize and respect different points of view. I don't have to accept it, and you don't have to accept mine, but we can respect each other. And I think that if we enter into our conversations with that level of humility, I think that we'll get further in terms of the outcomes that we want.
Absolutely. Thank you, Dr. Carter. Marissa, closing comments?
I am yet encouraged. As long as we are having conversations like that and the minds are meeting collectively to continue to have conversations, I know that we are reaching to an outcome. And so I am excited. I'm excited and I'm encouraged that we will get to what people suggest is herd immunity. I don't know what the number is now, but I am excited and encouraged that we will get there.
Thank you, Marissa. Dr. Furch.
Well, I'd like to thank everyone first for being on this panel and for everyone in the audience, listening and posing your questions, because this is how the conversation starts. But if we want to be really a part of the solutions, not be contrarian, not be a part of the rhetoric, but be a part of the solution for the change that we are so hopeful to see come through, we have to be responsible about the information that we take in and the information that we put out. So use your resources, go to your trusted, healthcare professionals, cdc.gov, your public health website, your community advisors, and stay informed and, keep each other safe.
Awesome. Thank you, Dr. Furch. The Conscious Lee.
Education is elevation, and really communal health is communal wealth. It's that simple, really. Communal health is communal wealth. Continue to have these conversations. Sometimes we're gonna disagree. Sometimes we're gonna, you feel me, get intense. But I feel like we gotta have those crucial conversations so we can understand and really elevate how communal health is communal wealth.
Thank you. Matthew?
Yeah, I think it's so important to be democratizing information, especially at this time. For so long, everyone likes to talk about health disparities within the Black community. No one talks about the resiliency and the strength that we bring in overcoming. And this too, we shall overcome. And we will continue to have the conversations to move our community forward because we know what our people need.
Absolutely. Last but certainly not least, Dr. Wallace, I'll let you have the final word.
Yes, thank you for that. And thank you to the panelists. This has been amazing. We will definitely be bringing you back on for future sessions. Some of you we've had on other sessions, so keep your emails clear and your phones off the on the hook so we can get you. But thank you to all of those in the audience who are who are paying attention, who are engaged, critical questions. This is not the end of the conversation by any stretch of the imagination. This is a continuation of a conversation. It's a conversation that impacts us all. It's about a topic relating to the pandemic that is still impacting us disproportionately. Please reach out to us at preventcovid.org. Please reach out to us on Facebook, on Instagram, and our YouTube page using the same name. And you will be able to access some of our information and videos that answers many of the questions that were raised in the chat as well. We will continue to have dialogue about this because the health of our communities is important. And I think it's important that I also acknowledge that we don't often have all of the answers to all of the questions as they come in. And it's important to also So where we don't have answers, we will find answers or we will circle back when we have them. Part of the role of science is not to know it all, is to sort of figure out the answers. And once we figure out an answer, we got to test it to make sure that's really the right answer. So this is a continuous process, and I'm looking forward to remaining engaged with you all, and wishing you all health and wellness and safety.
Thank you, Dr. Wallace. Consciously is bringing out the secret weapon.
Hey, it's bedtime and it's bedtime. You feel me? So they coming in, they know it's time to go to bed. So they really trying to calm me up, trying to butter me up. They don't know it's still bedtime.
But it's always daddy time. So we love to see it. I just want to say again, thank you to everyone who joined us this evening. I know there's a lot of chat in the comments section. There's a lot of questions. As Dr. Wallace pointed out, this is not the end of the conversation. You know, my name is, again, Louis Shackelford. I'm an external relations project manager at the COVID-19 Prevention Network. And my role and many others at the network, we have taken it on ourselves to create information for communities, for lay communities that are trying to understand what's going on in the world, what's going on in this pandemic. So please, our website is at the bottom. Please visit us. We have plenty of resources that we disseminate to community. You can use them however you like, whether it's your own personal education, educating people in your circle, or educating people in your community, in your organization, in your institution. So I just wanted to make that very clear. I want to also thank blackdoctor.org, who has been our wonderful partner in this event tonight. This event has been recorded and is available immediately on blackdoctor.org's Facebook page. It also will be on their YouTube page. You can also look out for social media, for this to appear on the social media pages of the COVID-19 Prevention Network as well. And so with that, again, I want to thank you all for making this an exciting conversation. Thank you to our panelists. Again, can't thank you all enough. This was amazing. And with that, everyone, please stay safe and keep loving each other. Bye-bye.